talking about hernia and hemorrhoids. What do they have in common? Well, these are two different conditions, but it seems like they have something in common. And joining us in the studio today is Dr. Kelvin Owusu, Wellness Consultant at Violet's Medical Center, and we like to call him, you know, our in-house doctor. Me and him have beef, but you're welcome.
Thank you very much. This one we'll deal with it later.
We have to deal with it, so it's almost 6 months. The viewers will be like,
Why you been beefing for 6 months?
Yeah.
But Chris, what is your problem?
One thing, Gary.
Don't worry, to be sorted. This one is not a problem at all. It's just a clash of schedules.
My Gary is inside my house. So I've eaten one container. I have 2 more.
Doc, you're welcome.
Thank you very much.
Don't listen to him.
No.
If you talk for him.
Oh, no. I don't even know him.
All right, Doc, you're welcome.
Thank you very much.
Hernia hemorrhoids. What is hernia and what are hemorrhoids?
All right, so there are two very, very different conditions, but it's quite easy to get them confused, you know. So it's a good thing we are talking about them this morning. So basically, hernia is a protrusion of an abdominal organ outside its natural boundaries.
Okay.
You know, so the most common hernia that you see out there is an inguinal hernia, where you find a bulge in the groin. Very common amongst men, even though it can happen in women as well. But by far, yes, by far, it happens more commonly in men, you know. And so you get that bulge in the groin, and it could end up in the scrotum, you know, because there is a potential space. When we say potential space, it's like a space that is usually closed, but when something gets in there, it can, you know, force its way through. So it connects from the abdomen all the way into the scrotum. And it's because of how the testes develop. Are you aware that the testis actually forms in the abdomen?
Yes.
Yes. So it forms in the abdomen, and then it travels.
It forms in the abdomen.
Yes.
So it comes from the abdomen down.
It comes from the abdomen down through this potential space, you know, and then ends up in the scrotum, you know. And so that pathway is where the intestine would also pass. But it's not only intestine that can form a hernia, you know. Fat can form a hernia. You know,
wait, is the intestine that forms the hernia?
Yes. So
it pushes through the hole.
It pushes through the hole and then ends up in the scrotum. And so that is the hernia. So once there's a protrusion of any abdominal organ outside of its natural boundaries, then you have a hernia. So with that in mind, you can have the inguinal hernia. You can have a hernia happening in the umbilicus as well, the belly button, you know, which is very common in children. You know, so children that have a big belly button is actually a hernia.
Okay.
The only thing is that hernia sort of treats itself as the child is growing older, you know, so that usually if by 4 or 5 years it's still big, then we may have to intervene because it means that the hole is maybe too big for it to close naturally, you know, and it's because that's where the umbilical cord is connected to the baby when they are developing, you know. And then there are other hernias as well, incisional hernias, which is a bit common and more common in women because of cesarean sections and other things. Incisional hernias would occur after a surgery, especially if the healing didn't go as well as it should, you know, so it results in a weakness in the surgical site, and then abdominal viscera can protrude through that weakness. And then there's a hernia that we don't see with the naked eye. Yes, it's called a hiatal hernia. It is when the stomach, and I'm using the stomach to represent the organ stomach, when the stomach moves into the chest, you know, that is a hiatal hernia. And it can cause quite a significant distress, especially with people with acid reflux.
Right.
You know,
that actually happened to my brother.
Exactly.
Yeah, that's when you asked us to go and check. Yeah, we thought it was like peptic ulcer because people just confuse it with peptic ulcer and GERD.
So the stomach as an organ has moved upwards.
Yes. And because of that, you see the diaphragm closes the stomach. So usually when you eat and you lie down, nothing from the stomach goes into the chest. You know, stomach has a lot of acid.
Yes.
You know, so the esophagus is not equipped to handle acid. Now, when the stomach shifts into the chest, then that diaphragm action is lost. So now the acid, you know, sort of moves freely up and down the esophagus, and that's when they get the acid reflux. You know, so it's a quite uncomfortable situation. You know, so all these are types of hernias. There are so many other types of hernias as well, but like I said, by far the most common of all the hernias is the inguinal hernia, and men suffer inguinal hernia far more than women do.
Right.
You know.
So when the hernia comes down to the ball sack or to the scrotum for men, that's when it has to do with your sexual, your sexual anatomy. Does it happen to women too when it comes to sexual anatomies?
So it can happen in women, even though it's not common, and it's because there's no such potential space in the woman. So you don't usually get the full hernia ending up in the labia. In the woman, it would usually end up in the labia. Yeah, the labia. But it doesn't happen as often. But yes, it can happen, especially if you ignore it. I mean, the hernia does not just start one day and end up in the scrotum. Okay. It takes a while. I mean, some men have carried their hernias for years. Some people, it actually becomes they are normal. I mean, just a couple of days ago, I had a patient who says he thought it was normal because he's had it since. As far as he can remember, he's had it. So he thought it was, and interestingly, his father also had it. So I mean, it's like that.
So is it hereditary?
It is typically not hereditary, but you see, it's more of behavioral, because the risk factors for developing a hernia involve heavy lifting. So anything, not heavy lifting, anything that causes increase intra-abdominal pressure. So let me start from there. So any condition that causes constant or consistent increase in intra-abdominal pressure can result in a hernia, which is also similar to the same thing that would cause a hemorrhoid. So that's why there tends to be that confusion. So anything so if you do heavy lifting as part of your job,
yes.
If you do heavy lifting as a choice, and what I mean, going to the gym, if you're a sportsman, you are doing heavy lifting, or if you have an illness like chronic cough. So people with TB can also develop hernia.
Because you're always contrasting,
exactly.
like when you're coughing.
Exactly.
So it's possible.
Exactly.
Oh, I can think of something. And I can think of something. What I'm thinking about is actually can appear to be hereditary, but it's probably not hereditary. So, Dr. Kelvin, how does this look? Mommy cooks food for daddy. The food lacks fiber. Daddy gets constipation all the time. But guess what? The food that daddy is eating, mom is cooking the same food for children.
Everybody,
so the children also eat the same food that doesn't have any fiber. And so the children also have constipation. So it may look like it's hereditary.
So that's what I meant by it's more of a behavioral thing. So if your parents are doing a particular thing that predisposes them and you also copy those things and you're doing the same thing, then yes. So constipation is also a risk factor for developing hernia. But interestingly, diarrhea also, especially if you have diarrhea, recurrent diarrhea.
That's hemorrhoids.
Both.
No. Oh, okay, both.
Yeah. Because when you have diarrhea, and especially when there's nothing in the abdomen and you are straining to get it out, all those things increase your pressure. And in this current generation, the mobile phone, the mobile phone is a big deal because
I know why.
but more for hemorrhoids than for hernia. When it talks about the mobile phone,
I get it.
Gravity.
Yes.
And
I also feel like sitting on the toilet for too long.
Yes, that's what I mean by
gravity.
That's
what the mobile phone. Yeah. Because you go there with the mobile phone.
Exactly.
Sitting on
so you sit on the.
you forget what you're doing.
And you see, when you sit on the potty, there's a hole in the middle, right? So there's direct action of gravity on your nether regions.
Okay.
So it's literally calling the things to be.
so the rectum and the colon are being drawn downwards because there's nothing to support them.
Exactly.
An open hole.
And you are sitting there for long. I mean, you know yourself. If you went to the to the loo without your phone,
especially in the morning,
you are there only like 1-2 minutes. You are out. If you go there with your phone, some people actually do their whole thesis on the potty. 30 minutes, they are there typing, responding, and doing all sorts of things. So it's a major risk factor, And then for men, again, prostate. So prostate problems will also increase your risk of developing hernias and hemorrhoids because of the straining. So anything that causes straining, anything that causes consistent or straining as part of as a routine will put pressure on your abdomen, which will cause you to develop hernias if you have the predisposition,
right,
and hemorrhoids as well.
Right. So I never knew anything about hemorrhoids until, let's say, 4 years ago, because I've been hearing people talking about it, and I hear cocoa, they are selling cocoa drew and all that. Right. So somebody actually, was explaining how she was feeling, and I like to Google, I like to read. So, and they were explaining everything, but there are types of hemorrhoids.
There are.
So, can you explain the type of hemorrhoids?
So, first of all, the biggest challenge with hemorrhoids is that name cocoa, and it's a very difficult term to define. You see, because they'll tell you I have cocoa on my eye, cocoa on my finger, cocoa on my toe, then cocoa of my anal regions. And I guess let me start by saying that not all cocoa is cocoa.
Okay.
The cocoa we are talking about is hemorrhoids. And hemorrhoids is actually a blood vessel that has protruded outside, of its boundaries. So you can now have external hemorrhoids and internal hemorrhoids.
Right.
Okay. Internal hemorrhoids are usually from the rectum itself, and most of the time it's internal. You don't see it until it's well advanced. So there are different stages of hemorrhoids. Maybe we'll talk about that a bit later. Then we have the external hemorrhoids. So generally, hemorrhoids by themselves are not painful. So that's what we're looking at. So what we are looking at here, so we are seeing an internal hemorrhoid and we are seeing an external hemorrhoid. Naturally, hemorrhoids are not painful, except they get complicated. However, if it's an external hemorrhoid, because it is now appearing at the anus, and the anus is skin.
So you feel
skin
it?
has, yes, skin has sensory nerves. So external hemorrhoids tend to be painful. Okay. But the internal hemorrhoids are not painful. In fact, the only way
Do you even realize that you have it?
Exactly. The only way you know you have a hemorrhoid
is when there's blood.
When it actually starts, you only find out when you clean yourself and you see some blood on your toilet paper.
Okay.
Or if you're observant, you might see blood on the stool. So you usually would not know that there's anything happening there. So when a hemorrhoid becomes painful, it's because it is now it is progressing. So then now something is now irritating it from the outside. So then you now start getting pain. But external hemorrhoids will start with pain. So you know that there's something wrong here. So you typically most of the time it's the internal hemorrhoids that are more common. Or rather, internal hemorrhoids will present a bit late because it's not painful. So I have other things to do. The economy. So everybody will postpone until.
How do we, first of all, deal with this when it happens? And then both hernia and hemorrhoids, how do we deal with them when it happens? And then how do we prevent them from happening?
All right. So let me first of all start by saying that there's no medicine, I repeat, there's no medicine that would cure a hemorrhoid or a hernia. Okay. There's no medicine. The conclusive or the definitive treatment for both of them is surgery. So
when it starts,
and the earlier you do this, for the hernia, for instance, the earlier you do the surgery, the better. Because it will get big. If both of them will get bigger. But you see, the hemorrhoid, we will not rush to go and do a surgery because it's a bit invasive. So and there are ways you can manage and slow down the progression. And I use the word slow down because, like I said, once it starts, you cannot cure it by any medicine. You cannot take medicine by mouth to go and cure
so all those cocoa and all those things, they are just...
Unless they are treating a different kind of cocoa. But the hemorrhoid cocoa, it is not curable with medication.
So as long as it starts, just know that you are living with it, but you have to learn how to manage it.
Exactly. So then you go back to what are the things that are causing this problem to start. So what symptoms, what are you doing that is causing you to have consistent increase in your intra-abdominal pressure? So if you're a man and if your age is, if you fit the age, then prostate, we'll look for the prostate. Is it enlarged? Is it causing urinary problems? If you're a woman, fibroid can also cause you to develop in any of these things because of the weight. It increases the intra-abdominal pressure. Or is there any other thing that's going on? Is your line of work putting you at risk? Are you a sportsman or are you a gym? Exactly. Are you using the tools necessary? Like the belt, especially, to support your abdomen when you're lifting heavy weights. Actually, the belt is not just for gym. Anybody who does heavy work needs to have a belt to protect them from developing a hernia, because even though hernias can live with, in fact, both of them can live with you for a while, but a hernia can also be acute. You see, because the space is very, very small. So if you are involved in a sudden lifting of a heavy thing and then the intestine forces its way through that hole, it can be trapped. And that's an emergency that needs immediate intervention. Wow. People have died because they didn't get hospital within time. So if you have a hernia and you are playing with it, it can end you up badly. But the reality too is that most people, because they have been doing it for a while, the hole gently becomes quite big, and it can actually have your entire abdomen, your entire intestine sitting in your scrotum. It can be that bad. So we need to eliminate the causes or the risk factors of the hernia. So that's the first way of dealing with it. If those don't slow it down enough, then we need to intervene and do a surgery. And the surgery is effective, number one. However, the hernia can still occur or can recur.
It can still come back?
Yes, because if you don't deal with the things that are causing the hernia, then your risk of
So those are the,
recurrence is still high.
The hernia.
And the hernia occurring on one side does not mean it cannot occur on the other side. And there are people that actually have hernias on both sides.
Oh,
so
wow.
yes, so you need to, if you treat a hernia on one side, you need to protect the other side as well. So I mean, all these things can
So
occur.
leave your mobile phone in the room.
Very
Don't
important.
take it to the loo.
And with the hemorrhoids, also it's surgical. Now the surgery may not necessarily involve cutting because there are other techniques now that can be implemented, like banding, among other things. You see, but the error
Banding
is that
as in inside there?
banding. So they will put a band at the base of the hemorrhoid so that it would kill the rest of the hemorrhoid, and then not. So it's a bloodless technique.
Wait, but wait, bloodless as in it still has to go through under there.
Oh, the surgery is in. I mean, the hemorrhoid is around the anus, so they'll have to go through the anus. You know.
I know.
So there's the open surgery where they will be cutting, among other things, and then there's the bloodless ones where they are going to band the hemorrhoid, and then sometimes with the bloodless one you actually go home the same day. You know. But the key thing is that it can recur, especially if the things that precipitated it are not dealt with.
Lifestyle.
The exactly.
Food.
The food.
You don't drink water.
And you're not eating fruits.
You're not eating fibers too.
Fiber. You know, you're eating a lot of processed foods, fast foods. All these put you at risk of developing hernias, hemorrhoids. And the most important one, the phone. You see, if you do a hernia surgery and you still go back and spend 30 minutes on the loo, the hernia, the hemorrhoid will come back. You see.
But usually, how long do these procedures take, especially with maybe hemorrhoids? Like, how long do the surgery?
The surgery?
Yeah.
So a hernia surgery can take anywhere from 30 minutes to about 2 hours, depending on the size
Will you be
of
sleeping?
Most of the time, you'll not be sleeping.
Hey.
They can even do a hernia surgery under local anesthesia. But if it's big or if it's complicated, then there's a high probability that you'll be asleep. You know, because if you are in excruciating pain, you cannot sit for the local anesthesia to be given. So they have to do a general anesthesia. You know. But it's typically, if everything goes well, it doesn't take too long to do a hernia surgery.
Right. and like, are there complications?
Of course, I mean, any surgical intervention, there are complications. However, this is one of the more common surgeries, and so complications are minimal. But still, we still need to emphasize that complications are possible. And the post-surgery recovery period and the period afterwards is very important. Between 6 weeks and 12 weeks after a hernia surgery, you cannot do any heavy lifting because you need to allow the place to heal well.
You gotta heal.
They would usually insert a mesh to support that opening, you know, that area, and so that mesh needs to heal well so that there's nothing will go through again. You know, so you need to give it time. And even after the 3-month period, you still need to be mindful when you are involving yourself in any form of heavy lifting. You see, there's a technique to heavy lifting that we all need to learn, especially if your line of work requires you to be in the field and be doing heavy lifting. You know, and if you don't learn that technique, you might end up with
like
some
the
of
way
these.
you carry, like
Yes.
the way you bend.
Those who go to the gym,
Posture.
those who go to the gym tend to learn these postures. Yeah? But when they now leave the gym and they go to the real world, then they just lift anyhow. You know, so we need to be mindful of all these things. Because you see, your body, you will pay for whatever you use the body to do.
Yeah.
You pay for it.
Right.
So we need to minimize the negative impact of our work on our bodies.
Yeah. So, Doc, what are the difference between anal fissures and hemorrhoids?
Wow.
Sorry, I thought I read a lot.
So anal fissure is a crack in the skin, you know, of the anus, and that is very, very painful. You see, hemorrhoids, like I said, I mean, you if it's an external hemorrhoid, it will be painful, and when you put your finger there, you can actually feel the bulge because it's a blood vessel, so it's very soft. And if it does get cut, there's significant bleeding. You know, so that's a hemorrhoid. The fissure is a crack. So when I say crack, I mean it's like a cut in the anus,
skin itself.
in the skin.
Yeah.
You know, and it's quite difficult to treat. Because on one hand there's a lot of bacteria in that same space,
that
you know,
area.
so it gets it's quite difficult to treat. It requires, should I say, a multifaceted approach with multidisciplinary team. That's what I'm looking for.
For one thing.
Yes.
For a crack.
So don't get a crack.
So don't get a crack. Do things not to get a crack.
But you see, again, the things that will cause you to develop a hemorrhoid are similar to the things that will cause you to develop a fissure. Same constipation, you know. So constipation is not something that you should be proud of, especially the women. The women, for some reason, women tend to keep their poop longer than men. I don't know why. I mean, I don't know the science behind it. But whereas most men would typically poop at least once a day,
Do you think it has to do with our body type?
it's possible. I mean, the hormones and among other things, you know, it's definitely possible. You know, but women tend to poop less, which is not a good thing.
So what should we do to poop more?
Habits. Number one, you need to develop the habits. You know, when you wake up, go and sit on the loo. You know, you train the body to, you know, poop to respond.
Yeah.
You know, but don't take the phone, because then that will now be putting you at risk of something
Hey.
else. And then eat well, so fiber. Eat a lot of fruits and vegetables. And when I say fruits and I'm talking about the natural fruits, not the box juice, because most of the box juices don't add the fiber. So if you take the box juice, you are not achieving much. You see,
And it's
so
processed.
exactly. So you eat fruits, eat vegetables, especially fresh fruits and vegetables. The fiber retains water, makes the stool soft, and then you have a good time, you know, on the loo. But if you don't do that, then you're so if you're not eating the fruits and vegetables, and then you are keeping your poop longer, the body will keep absorbing water, and so that's why the stool gets firmer and firmer. And then you might end up in hospital for somebody to actually remove the poop for you. So we don't want that to happen.
It happens?
Oh yes, it happens. It's
Like
called
the poop
fecal impaction. The poop cannot come out, so we have to go in and remove it. You see
By
how,
surgery?
You see how by hand, which
By
surgery?
hand.
You have to go in and bring it out.
Oh
So you enter
no.
the car and then drive all the way to the
no.
hospital for someone to put the
Oh
hand in.
yes.
Sorry, it's early morning, I know. Just let's not think about it, but yeah.
So you see, eat fruits. I mean,
And drink water.
And drink water. I know the economy is a bit hard, but honestly, fruits make a world of difference. Bananas, oranges, mangoes, pineapples. You know, at least one fruit a day will help you ease a lot of distress.
Super. Thank you.
Right.
Thank you.
Thank Doc. Thank
Well,
you so
this
much,
has
Doc.
been a
Yeah.
rather enlightening.
Conversation.
Yeah.
Yeah, I need to buy more fruits.
Yes, you do.
Yeah. But actually, like on my phone, I have a reminder to always drink water.
Yes,
So,
water
because
is
I
important.
tend to forget. Yeah. Anyway, Doc, how can people reach out to you?
Well, I'm active on social media. You can reach out to me at Kelvin, also MD on all channels. And you can also follow our clinic page as well, Violet's Medical, on all channels.
Right. Thank you. Thank you so much. It's been an interesting conversation. Remember to drink water, eat some fiber and more fruits, and go to the loo without your phone. Drop the phone.
That one.